Today, we're going to try and cut through all the noise on food labels. Seriously, let's just forget about counting calories or sugar for a minute. We're going to dive into a really powerful, kind of new way to understand what we're actually eating. And this is all based on a pretty groundbreaking report from the Food and Agricultural Organization of the United Nations.
So let's just jump right in with a huge question. For decades, we've been told to focus on all these individual things. Is it low fat? Is it high protein, low carb? But what if that's not the whole story? What if we've been missing a bigger and, honestly, a much simpler factor this whole time?
We've all heard that advice, right? Oh, you should eat less processed food. It sounds so simple, but then you're standing in the middle of the grocery store and it gets confusing fast. The term processed has become so broad that it's almost totally meaningless. I mean, think about it. You've got a beautiful loaf of sourdough from a local bakery. Someone had to mill the flour, mix it with water and salt and yeast, knead it, let it rise, then bake it. That's a lot of processing, isn't it?
Or, a simple can of chickpeas. They've been cooked and canned so they last longer and are way easier to use. That's definitely a process. But is a can of chickpeas bad for you? I don't think anyone would say that.
And what about something like plain yogurt? The milk is pasteurized, it's fermented with live cultures. It is, by definition, processed. So where on earth do we draw the line?
And that right there, that is the whole point. Processing itself has never been the enemy. Humans have been processing food for thousands of years to preserve it, to make it safer, to make it taste better. So the real question isn't if a food is processed. It's how it's processed, how much it's processed, and maybe most importantly, why it's processed.
Okay, so how do we make sense of all this? Well, luckily, scientists have given us a really clear and powerful framework to help. It's called the NOVA classification system, and honestly, it could completely change how you see the food on your plate.
It was developed by researchers in Brazil, and the real beauty of the NOVA system is its simplicity. It doesn't get all bogged down in nutrients and percentages, nope. Instead, it looks at just one key thing, the level of industrial processing a food goes through before it ever gets to you.
So the system divides literally everything we eat into 4 simple groups. Group 1, that's your fresh stuff. Fruits, vegetables, meat, eggs. Group 2 is your culinary ingredients, things like oil, butter, sugar, salt. Group 3 is what we think of as processed foods, like that fresh bread or the canned chickpeas. But the one we're going to focus on today, the real game changer, is Group 4, ultra-processed foods.
Let's really dig into this one, because if you can understand this single category, it can radically simplify how you think about healthy eating. So what is it exactly that makes a food ultra-processed? The key is right here in this official definition. These are not just foods with a few things added to them. They are industrial formulations. You should think of them less like food and more like edible products, created in a lab, mostly from substances extracted from foods.
This slide just says it all, doesn't it? On the left, you've got simple processed bread, 4 ingredients you'd find in any kitchen. On the right, ultra-processed bread. The list just goes on, and it's full of things you would never ever cook with at home, like soya protein isolate or emulsifiers. See, this isn't really bread anymore. It's a product designed for a super long shelf life and to be, well, irresistible.
So how can you spot these things in the wild? It's all about reading the ingredients list. You're looking for these red flags. First, stuff you would just never have in your kitchen. Second, additives that are only there to make the product hyper-palatable. That's a scientific term for addictive levels of tasty. And third, cosmetic additives. Things like colors and gelling agents that are just there to make the final product look appealing. If you see a bunch of those, you're probably holding an ultra-processed food.
Okay, so we know how to identify them now. But so what? Why is this such a big deal? What does the science actually say about how these foods affect our health?
Well, the consistency across the research is pretty striking. I'm talking studies in 11 different countries, and the pattern is always the same. As the amount of ultra-processed food in a person's diet goes up, the overall nutritional quality just tanks. These foods are way higher in added sugar and energy density, and they strip out all the good stuff, like fiber.
And if you want a really jaw-dropping number on that, check out this stat from the US. People who ate the most ultra-processed foods were 3 times more likely to blow past the recommended daily limits for added sugar compared to people who ate the least. That is a massive, massive difference, and it's all by design.
And look, this poor diet quality isn't just some abstract idea. It has real, measurable, and pretty scary consequences.
So let's look at the direct link that researchers are finding between ultra-processed foods and actual disease.
This first one is a really fascinating study that looked at 19 European countries, and they found a direct correlation. As the market share of ultra-processed foods went up in a country, so did that nation's obesity rate. It suggests that our food environment itself is a huge driver of public health.
And it's not just a trend you see at the country level. A huge study in Canada brought it right down to the individual. They found that the group of people eating the most ultra-processed foods had over 50% higher odds of having obesity. And this might be the most sobering finding of them all. A major study in Spain followed almost 20,000 people for more than a decade. Their conclusion? The group that ate the most ultra-processed foods had a 62% increased risk of dying from any cause during that time period. And look, this isn't some fringe idea from the internet. This is a quote from the director of the U.S. National Institutes of Health. After a landmark clinical trial, the advice from the very top of the scientific community is pretty darn clear. Focus on reducing these specific foods.
So, after looking at all of this evidence, what's the big takeaway here? How can we actually use this to change the way we think about the food we eat every day?
Well, maybe it's this. Maybe it's time we stop obsessing over every last gram of fat or carbs or protein and instead just ask a simpler, more powerful question. How processed is this? Shifting your focus from the nutrition facts on the front to the ingredients list on the back, that might be the most effective health strategy you have.
So I'll just leave you with this final thought. Now that you have the tools to actually see these foods for what they are, start looking around. The next time you're in a supermarket or watching TV, just notice how much of our environment is engineered to push these products on us. Because once you see it, you really can't unsee it.